Is there a point where mental health awareness backfires? Is there a point where we have so much focus on mental health that we actually make ourselves more sick? And if that could be true, what does that mean for therapy? Let's talk about it. Hi, I'm Jessica Johns Green. I'm a licensed professional counselor. I work a lot with body issues, including eating disorders. I've had a lot of expertise in working with trauma. I also work with general mood issues like depression and anxiety, and things that affect relationships like anger management and communication. And let's talk about mental health awareness, something that sounds so positive, and that I would say that really you know, behind the idea that we need a certain amount of kind, compassionate awareness towards mental health. That maybe for the majority of human history, there has been very negative views about mental health problems that people can suffer, and perhaps it's good that we think about them. But is it the case that more awareness is always better than more talking about something is good? Could it be that there's a point where awareness tips over into a fixation, a sort of obsession, a sort of constant hunt for what is wrong with me or wrong with people psychologically? Are we there? I have to admit, I have big questions, and I'm not coming at this video with, hey, this is the answer, but just ideas and concerns, things that maybe you as a consumer of perhaps therapy services or thinking about your own mental health or those around us, especially consumers of things like YouTube and social media, we need to at least have some awareness to be healthy and to be informed. So, when I think about this topic, I go all the way back to freshman year of college, taking Psychology 101. I got a great big textbook. I could not wait to get dug into these juicy mental health disorders, right? And on this journey through learning about the brain and learning about disorders, and later on, even, on into graduate school, when we're getting deeper into what these disorders look like and how to work with them, there is something that happens to students so commonly that they had a name for it. They called it kind of Psych 101 osis or something like that. Osis, itis, something like that. It's this phenomenon where when you're really digging into learning about all the things that can happen with the brain, the nervous system, our emotional health, we start to identify with this stuff. So it's not uncommon to say start learning about depression and think, goodness, maybe I'm not just a bit down, maybe I'm depressed. To learn about personality disorders and suddenly be like, oh shoot, here's what's wrong with me. I have a personality disorder. And I'm not saying that we can always be wrong about that. Maybe there are times when we didn't realize that this level of, say, anxiety or depression that we were going through was actually to the point where it could be a disorder. But more often than not, what's happening is that we are overly identifying with an experience, and it's not actually to the level of it being a disorder. But by focusing on it, we get this Psychology 101 is osis, whatever it is, right? Where in your first years of learning about things, we start to wonder, is this me? Is this me? Is this me? The truth is, I think part of that is because we have a lot of commonalities across the board. Even if we look at people who have severe mental health problems and people that maybe say don't, we have more in common than we do have different, so we can identify with one another. Part of the whole reason why therapy works is because people will try to see things from another person's point of view. With rare exceptions, there are people who maybe don't want to do that or don't have that natural capacity, but those are more very rare extreme cases. For the most part, people want to be able to understand the other person. They want to be able to see it from their point of view. And we have ways of, you know, sort of getting into the mind of the other person that can make us overly identify. So, all of that to say that there's a difference between just learning and having an awareness versus having fixation, right? So, back to this psychology 101 experience, we start to get really fixated on looking for, do I have this wrong with me? Do I have that wrong with me? That's when we start to label ourselves and think, gosh, I have this disorder. We fast forward to just a few years ago in 2020, we as a planet went through a really pivotal time. Everybody withdrew into their own little shells, almost everyone. Some people have never really gone back into the way of life that they were living before. And in that separateness, there's a lot of room, there's a lot of space to self reflect. And again, I think that was really important. You know, many clients that I work with, myself included, 2020 was a real time to examine, what am I about? Why am I doing what I'm doing? If I have to go back into life tomorrow, do I want it to be the same or be different? And for a lot of us, that led to questioning, well, why do I feel what I feel? And here, on the other hand, we have this. We have TikTok, right? And TikTok, Instagram, whatever, you know, but particularly I think TikTok, a way of sharing this quick, easy information with one another. And a lot of people started talking about where their mind was at, some of the things they were struggling with. And again, we are maybe at risk of over identifying with people, as well as maybe fixating on these things. And without the kind of structure of work and normal interactions, we can become a project to ourselves, become overly fixated on things. You know, to be fair, there are creators on TikTok who saw a lot of, you know, misinformation, weird information, maybe people coming on and saying, hey, you have this disorder if you fit this and this, you know, how they point around the screen, this and this, then that you, maybe this is you. And a lot of very much more informed creators came in and have been giving better information on topics around psychology, psychiatry, and mental health. The problem is that if you are naive to these things, how do you know, right? And you're going to end up getting stuff sent to you that is maybe popular rather than true. So there's positives and negatives, right? Maybe some positives in that there is some decent information out there and more opportunities for people to feel connected to others who are going through difficult things, but negatives in that we have no way of knowing whether or not the information that we're getting about self-diagnosing, for example, a mental problem, a mental health diagnosis is going to be accurate. In fact, I think we're more likely to mislabel ourselves and come to inaccurate conclusions than accurate ones through something like TikTok, simply because of that idea of, you know, fixation and over identification. You know, there's other evidence out there that lend more credence to the idea that too much awareness, if you will, if you want to call it that, can harm. Um, Too much maybe focusing on a problem can harm. So there's research that shows that venting, you know, just venting to a friend, venting to your therapist, can increase the negative emotions and, you know, maybe make the person feel worse over time. There's a difference between venting and getting support for a problem. There's a difference between venting and, I want to understand what's happening to me so that I can make something different happen. Venting is kind of like a complaining, right? Which we all do. But if we notice how we feel, oftentimes after we complain, we don't feel better. We just think of, oh, and this other thing, and this other thing, and this other thing, right? And so I think that that research around venting can, again, give a little bit of credence to this idea that, you know, bringing our awareness to one thing and sticking it there may have negative consequences. Some of the other research that leads me to question how much awareness is good awareness versus how much is backfiring on us relates to research around post-traumatic stress disorder, PTSD. And research that suggests that having a debriefing, as they call it, after a very significant or upsetting event, that this debriefing might actually increase the rate of post-traumatic stress disorder that arises in people afterwards. So debriefing is like, let's say at your office, something terrible happens, someone passes away, or there's some kind of attack or something like that, and they'll bring in a bunch of maybe therapists or psychologists who will sit down and debrief you. And oftentimes this debriefing is maybe legitimizing some feelings that people may have after a situation. Sometimes also can lead people to think, so they theorize, lead people to think that they are going to have a traumatic response to this, meaning that it's going to play on their mind in some way, maybe interrupt their sleep, interrupt their normal ways of thinking, normal ways of behaving, and affect their mood on an ongoing basis. And what some of the studies have found is that at best, debriefing does nothing to mitigate, to help people avoid PTSD. But at worst, debriefing can actually increase the rate of PTSD. And if you're curious, I'm going to put these studies down below. The one is some information about venting, and also these studies about PTSD, just if you're curious for your own understanding. So this leads me as a therapist to really wonder, like, well, how do I integrate this information into creating a healthy and safe practice for people? Want to help people to feel better, not worse. And sometimes helping people to feel better is about mental health information and awareness, and helping them to know that there's places they can go, there's things they can do, and not to feel alone, right? Not to feel that there's some sort of failing in them morally if they're having a problem. On the other hand, too much awareness, too much venting, focusing on the problem, fixating on the problem sounds like it potentially can make a person worse. And at the risk of doing myself out of work, I would much rather help people and help them to get better and get away from therapy, get away from fixating on their problems, than to have them maybe sitting in a therapy room for years on end, doing a sort of witch hunt for what's wrong with me now, what's wrong with me now. Or even worse, oh, I saw this TikTok, now I think I have this diagnosis. So how to work with that if you are either a therapist or you are a consumer of mental health topics, mental health interventions, how to work well with this, how to be ethical if you're a practitioner, how to be safe and caring to yourself if you're a consumer. I think primarily I would just go back to having that question for yourself. Is this kind of awareness a healthy kind of awareness where, I'm genuinely wanting to learn and understand and comprehend so that I can live better, I can move beyond something? Or is this more of a kind of a negative fixation that is about keeping me stuck? And how we can kind of dig into that deeper is like, how empowered, say, do you feel? How much self-efficacy do you feel with the way that you're approaching the 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 label that you've come to, or the mental health diagnosis as you understand it? It's really tough because I think most mental health practitioners would agree that having awareness around mental health issues can help people to feel less disconnected, to feel maybe more hopeful, to feel more motivated to do something. But I think there are cases where having a diagnosis, having a label actually makes people feel like, well, this is just me now. This is just me, and I can't get any better because I have this. This means my brain is messed up, or this means I had um, a trauma reaction that I just can't get over. And I think that's where it tips into unhelpful. If the amount of validation that we're getting from social media is leading us to think, everybody's like this and no one can get better, then we're on dodgy ground. Likewise, if your therapy is turning into some kind of super long-term witch hunt for problems, or if it's becoming kind of deviated from, having a set of goals that are about helping you live happier, helping you live healthier, helping you to feel a sense of confidence and efficacy in yourself, if you're feeling more and more helpless, then these might be some potential warning signs that you need to get back to the drawing board with yourself or with your therapist, maybe having a discussion with them about what is the end goal here? What do we see as the outcome or the potential way to get through these problems? There's nothing wrong with having long-term therapy. There's nothing wrong with dipping in and out of therapy for the majority of your life. For example, as a therapist, I think it's very important for me to keep a close eye on how I'm doing psychologically, emotionally, and I will dip in and out and probably will forever. But that's tied to a specific reason and a specific goal, which is not that, hey, I'm just a messed up person. If therapy or anything that you are engaging with is reinforcing that you're just a messed up person and you have very little control over that, then this may not be the healthiest type of mental health help or mental health awareness for you. I know this might be a contentious subject, and I would just be really happy to hear your input and your thoughts. Please drop them down below. Let me know your comments. As always, like, share, subscribe, all those things I'm so grateful for. And until next time, be well.